Hey y'all, and welcome back to Life Unscripted. In today's video, I'm going to be telling you about my horrible hospital stay experience. And stay tuned to the end because I'm going to tell you how you can prevent this from happening to yourself or to a loved one. Come on in and let's talk about it. Okay, so let's get right to it. So back in January of 2018, it was on a Friday, and I had pulled into a grocery store parking lot in the town where I was living. I was working at the time. I was doing home health, and I had pulled over into the parking lot because I like to take a minute and just read over the patient's information. If you don't know, I'm an RN. I work for home health, but I pull over so that I can review a patient's information and what was discussed and what was done on the last nursing visit. So that's what I was doing at the time. So I pulled in. I had had a bad cough for probably going on 2 months, and it just wouldn't go away. So this patient was my final patient of the day. And as I'm sitting there and I'm looking over her information, my husband just happened to call. And of course, I was coughing throughout the conversation. And he asked me where I was. And I said, well, actually, I'm at, Publix parking lot. And right across the street from Publix is the hospital there in the town where we were living at the time. And we actually lived in a neighborhood right behind the hospital. So he said, hon, he said, it's Friday. Why don't you go on over to the ER? He said, are you done working yet? And I said, no, I have one more patient. And he said, well, where is she? And I said, she's in such and such facility. He said, I really don't think it's a good idea for you to go into a facility. Whatever's going on with you, like it could be contagious. So I said, yeah, you're right. So I called the office, told them what was going on. They rescheduled my last patient to another RN. And so I went on over, well, actually, I went home first because he wanted me to get our girls and let them go with me. Plus, I wanted to change out of my scrubs. And so I went to the house, got out of my scrubs. I think I put on some sweatpants and a t-shirt, just got comfortable. And the girls were getting their stuff, together. They were going to go with me. And I laid down on the bed for just a minute and I thought, oh my God, this feels so good just to lay down. And so they come into the bedroom to tell me that they're ready to go. And my daughter looks at me and she goes, Mom, you look horrible. And I was like, gee, thanks. Okay. So we get to the ER and I get called back. And of course, they do all the things, they draw blood and um, got a chest x ray. And so in the meantime, my husband got there. And at the time, he was a captain paramedic um, there in the county where we were living. And he was on duty at the time. So he put himself, oh shoot, what do they call it? Out of service and came to the hospital. And so he was there when the doctor came in, the ER doc. And he says, well, you have pneumonia according to your x-ray, your chest x-ray, and I'm pretty sure you're septic. He said, so how do you feel about staying the night in hospital? And I said, well, I'd really rather not. And my husband go, yeah, she's going to stay. And so they were getting all of that arranged, and I had to get up and go to the bathroom. They had started an IV in me. And so my husband assisted me. We were walking to the bathroom, and suddenly I felt very weak. I was absolutely freezing. Got done in the bathroom, went back into the little ER room where we were, and my husband goes and gets the nurse. So she comes in, checks my temperature, and I spiked 102 fever just that quick because just a few minutes earlier I felt fine, and I just wanted to get, a prescription for some antibiotics, and I wanted to go back home. And so things changed very suddenly. So as I'm in the ER, I started complaining of, my back hurting. And the doctor came back in and he said, "Well, do you want me to give you something for pain?" And I kind of thought about it. And then I said, "Well, yeah, because, in my mind, I didn't know how long I was going to be there. And really kind of felt like my back was about to start giving me fits." And so I agreed. And I believe they gave me some morphine at the time. It was something like 2 milligrams, so it wasn't a whole lot, not for my height and size. But so that was the first thing. Um, and it really, I mean, that's not all that uncommon when you think about it. It's just kind of everything that happened after that. So he comes back, the doctor comes back and he says, "We got your labs. Yes, you were septic. It's double pneumonia. And so we're going to get you a room upstairs and get you started on some IV antibiotics." And so my husband and daughter stayed with me until they got me into a room, and everybody went home. And I was fine. They were starting antibiotics. They were running fluids. So in hospitals, most hospitals work primarily with protocols these days. And so this hospital had a sepsis protocol that they put into action. Um, and part of that protocol is, you run fluids, you push fluids in order to flush out the sepsis. And so that's what they were doing. Um, I was there, I was probably coming up on the end of my second day because I went in on the 18th. I went in on January 18th of 2018 and I discharged home on the 20th. The first 2 days were spent on a med surg floor. So this is, the second day coming to an end. And I'm like, I'm not really feeling that great. And this was on a Sunday. And I had been declining since Friday night. So since the first night there, I could tell that I just wasn't getting any better. And so I I began to I was still coughing, number one, but every time I coughed, I would soak the bed. I would urinate in the bed because they were pushing the fluids to the point that I was constantly having to pee. And so I didn't really have the energy at that point after a couple of days to really get up. I was really struggling. And so I called the nurse and I said, "Listen," I mean, they had already brought me the, what do you call it, the pull ups, the briefs, to try to help with it. And that just wasn't working. It wasn't holding it all. And when I tell you they were running fluids wide open, they really were. And so I told her, I said, "Can you please just put a catheter in me because I can't keep getting up and going to the bathroom." I said, "I can't physically do it anymore." And so she said, "Okay." And she left the room. Well, it was another like 30 or 45 minutes, and I had to go to the bathroom again, and I couldn't wait on her. I had hit the call bell. They said, "Yeah, we'll get your nurse. We'll get your." Well, she never came. And so I got up to go to the bathroom, and I actually made it to the toilet. But then when I got up, I couldn't get back to my bed. So you, at this hospital, it was, you shared a room with somebody. It wasn't a private room. And my bed was right next to the door to the bathroom. So it was literally like 3 steps from my bed into the bathroom, and I couldn't make it. And I kind of fell over, so I pulled the cord in the bathroom. And after a few minutes, somebody came in, but had I been in there having a heart attack, I would have been gone. So she said, "Oh, ma'am, what are you doing? What are you doing?" And I said, "I told you I can't get up and go to the bathroom. No one is helping me." And back up a little bit, I had already asked for, before she put the catheter in, I had already asked for the bed to be changed, and nobody came to change it. So I ended up, as bad off as I was, changing my own bed sheets. And after I did that, or after I went to the bathroom that time, she helped me back into the bed. That was it. I couldn't do it anymore. and I kept telling my nurse, I can't breathe. It's hard to breathe. It actually hurt to breathe. Every time I tried to take a breath in, it felt like um, if you've ever had salt water in a wound, that's kind of what it felt like. It felt like I had sand on the inside of my lungs, and every time I took a breath in, it just felt like it was clawing the inside of my lung tissue. And she says, "Well, I don't know. I don't, I turn your oxygen up to 4 liters. This is saying you're at 100%." And when she said that, in my nursing brain, I knew that that wasn't the problem. However, I couldn't articulate that to her. Oxygen was not my problem. It was my CO2, because even though it hurt to breathe in, my problem was getting my air out. So I was taking in oxygen, but I was retaining CO2 because I wasn't exhaling completely. And I got to the point to where I knew if I didn't call my husband right then, I wasn't sure what was going to happen. And so I picked up the phone and I dialed his number. And when he answered, I handed my phone to the nurse because I just really couldn't speak at that point. And so she told my husband, she said, "Yeah, she's just having a hard time breathing, and I think she wants you to come up here." And so he gets off the phone with her, and after about 10 or 15 minutes, I see him come to the door, and he stopped, and he turned around and he walked away. And he knew by looking at me that I was in trouble. And I didn't realize that he was going to get help. And so I started freaking out. I don't remember doing any of this, but from what he and the doctor told me, I had gone into a hypoxic rage and was knocking things off of the table. Um, I was trying to get up. I was trying to, I don't know. They said I was just fighting. I was in a hypoxic rage. And so my husband comes back in. Well, let me back up. So this was the story that he had told me after I got home. So when he walked out of my doorway, he went to the nurse's desk and he said, "Hey, my wife is in trouble. She needs help." And so the nurse turns around and she goes, "What's wrong?" And he said, "She can't breathe. She needs a doctor right now." The nurse rolled her eyes at him and turned around and faced the computer again. Yeah. Being the paramedic captain there in that county, he knows people at the hospitals. They have to work together on patient transport. Um, he goes to meetings with the CEOs, the hospital board, uh, nursing management. He goes to some of the the case meetings. I think that's what they called them. And so he knew people. So as he's turning around from the nurse's desk, there's a doctor coming out of my room. Now, he had come in and he had seen my roommate. He said, "Doc, my wife is in there. Can you please check on her? She can't breathe." The doctor never stopped. He never acknowledged my husband. He kept walking. He says, "Are you effing kidding me right now?" So he goes back up to the nurse's desk and he says, "I want a doctor in my wife's room right now." "So there's not a doctor available right now." He said, "I just watched a doctor come out of her room and walk off the. Get him back in here." "Sir, he's no longer in the building." He said, "So you're going to tell me that she's in a hospital with an ER, with an ICU unit, and you have no doctors available?" Okay, so he goes up. So I think now we are into he goes must have been Sunday morning at that point, and you'll have to forgive me because like I said, I was out of it for days. But anyway, he goes up to the CEO's office and the CEO stood up to like greet him because he knew each other. He said, I got up into his face and I said, if I want a physician in my wife's room now, or I am going to call my guys to come and pick her up and we will take her to a different hospital. And the guy's like, oh, okay, Ty, what's going on, man? So he told him what had happened with the nurse and the doctor that walked out. He says, oh no, Ty. He said, here, who's her pulmonologist? He's like, I don't know. They haven't told us who her pulmonologist is. I don't even know if she's been seen by a pulmonologist. So they find out who the pulmonologist was and they called him. Uh, and he was actually on the way to the hospital. And so he's like, okay, I'm on my way. I'll be there in 5 minutes. Well, when he got there, he came on in, and apparently he had um, written an order the day prior to stop my IV fluids. So what they were doing was they were taking my blood. You know how they do in the hospital, take your blood every, I don't know, 4, 6 hours, every 8 hours, something like that. And so my ABGs had begun to drop. So your ABGs tell a doctor about your gas exchange. And so that's what they were looking at. And it was getting worse. It was getting critical. And so he wrote an order to stop the IV fluids. Well, the nurses didn't do that. They didn't follow a physician order. And so here I was in respiratory failure. The nurse that I had just simply kept turning up my oxygen. Didn't really click with her that maybe, I should probably call respiratory. Um, so yeah. So my pulmonologist called respiratory and he says, I want respiratory in here stat. And apparently he and my husband had the same discussion about I'm going to call my guys and have her transported out of here. And he says, Ty, I don't know, if that's the best thing for her. It looks like I'm going to have to intubate. And he says, not in this hospital, you won't. And he says, if that's what you're going to do, I'm taking her out of here right now. I'm calling my guys right now. So you have to understand, guys, this hospital was not a hospital that if you knew the reputation of the hospital, you would go to for anything serious. Um, I didn't think that it was going to get bad. I didn't think it was going to go south the way it did, or else I would have gone to another hospital. So my pulmonologist said, okay, let me get respiratory. Let's try her on a BiPAP, see how she does. Let's give it an hour or two and see if she starts improving. So my husband agreed. The doctor called respiratory. Respiratory came in, and I saw my husband and the doctor standing in the doorway. And the respiratory therapist came in. And at this point, y'all, I'm still sitting up in the bed. I'm holding on to both of the handrails. Um, I was doing that whole tripod thing. If you're in the medical field, you'll know what I'm talking about. But I was sitting up holding on to the bed. I could not breathe. I was struggling so hard and it was so painful. And this girl says, okay, I need you to lay back. And I shook my head. No, because if I laid down, it was even harder to breathe. And so she set the head of the bed up. She said, here, let me set the head of your bed up. And she says, okay, so your doctor wants you on a BiPAP. And so here you go. And so she turned the BiPAP on and she comes at me with this mask. Now, keep in mind, I already can't breathe, and I've got somebody coming at me to cover my face. And so I slapped it away. Not really, I wasn't in my right mind at that time. This girl was about 5'5", if that. She was a tiny thing. And so she goes, "Oh, you don't want it? Okay." And so she turns it off, changes the mask up, and she walks out. And so I could see my husband, I couldn't see the doctor. My husband turns to come in, and he turned and he looks out, and what he was doing was he was saying, "Hey, doc, that respiratory therapist did not put the BiPAP on my wife." So he comes running in there and he goes, "What the hell?" And so he calls the respiratory therapist back. She comes in there and he goes, "Why isn't this on her?" "Well, she didn't want it. She slapped my hand." And he says, "Oh, for the love." And so he came at me. Now, granted, I'm laying back at this point. The head of the bed is up and I'm laying back a little bit. And he gets in my face and he says, "Miss Carhart, if you don't put this mask on your face and let this BiPAP help you, you are going to die." And so at that moment, he said, "Do you understand what I'm saying?" And I can remember shaking my head yes. He says, "Okay, the machine is turned off. I'm going to hand you the mask. I want you to put it over your mouth and your nose. It's going to help you to breathe. You won't have to work so hard. You can relax. This is going to save your life. So I need you to do this." And so I did. I put the mask on my face, and as soon as he turned that machine on, I remember feeling like, "Oh my God, thank you." All of a sudden, I could breathe without it hurting. I laid back in that bed and I don't remember anything for the next couple of days. My husband said I slept pretty much solid for 2 days. Um, they moved me at that point up to ICU, and they put, of course, I think that hospital was a one-on-one anyway in the intensive care unit. And so I had just the one nurse, and she was, watching me every step of the way. And he says, I want numbers on her every 15 minutes. I want to know what her oxygen sats are. I want her ABGs checked, you know, this many times in an hour. And I mean, he was just rattling off stuff. And so, come to find out later, um, the nurse in my room was this. She had both of us, so she had me and my roommate. Now, when I worked in the hospital in Pensacola, Florida, if there were two patients in a room, they did not have the same nurse because it's too easy to confuse medications and that sort of thing. So in reading, I did go and get a copy of the record for that hospital stay. And in reading it, um, this was from the first night there, I believe it was. My roommate had gastritis, I think. And so the nurse came in and she says, I guess she had called the nurse in for some pain meds. And she says, "Do you want morphine or Dilaudid?" She said, "Well, the morphine gives me a headache, so I think I'll take the Dilaudid." Um, she said, "I haven't taken morphine in years because of the headaches." So the nurse says, "Okay." And she goes out and she comes back and she gives the lady the morphine. And so I read that in my hospital record after the fact. Um, when I was all better, I took a week or two to recover, went to the hospital, picked up my records, and I read that. in my hospital record. Um, what I also found out was that they had been giving me narcotics on a scheduled basis, PRN narcotics on a scheduled basis, and I wasn't asking for it. So now you have, not only did I have double pneumonia, my ABGs were tanking. I was about to check out of this world. You don't give somebody in respiratory failure narcotics. So they had given me about 4 doses of morphine in a 48-hour period. And when you think about that, how can I explain this if you're not in medical? Um, so an opioid or a narcotic decreases your respiratory system. Let's just put it that way. Um, and so it affects your breathing. And so on top of everything else that I had going on, I had a nurse that was bringing me narcotics on a schedule so that she didn't have to come back when I requested it. I didn't even know they were on my EMAR. I didn't know they were on my medication list. So why would I have asked for it anyway? And if I had asked for it, and if it had been on my medication list, which apparently it was, she wouldn't have been able to give it. But had I known, um, I wouldn't have asked for it because as an RN, I know that as bad off as I was, that was a no-go. And so that was something that had happened to me. Um, my our girls, my daughter and Ty's daughter were teenagers, so I didn't expect them to stay up there with me all night. Um, he had to work. I'm grown. I'm an RN. We didn't think things were going to go south, but they did. And I almost died. Um, I came as close to death as I've ever been. And it was painful. I was in excruciating pain for probably close to 48 hours. Um, I was pretty much begging with the nurse, help me, I can't breathe. Why is it so hard to breathe? Okay, now it's hurting to breathe. I can't really get in a whole breath. What's going on? Well, I've got you on 4 liters. There's really nothing I can do. The pulse ox is at 100%, which that's the little thing that they put on your finger to check your oxygen level. She said it's at 100%. And in my brain, I'm thinking, yeah, no shit, Sherlock. It's going to be 100%. You've got my oxygen on 4 liters. Um, so after that, I went home. I took a week off, the next week off of work to just kind of relax a little bit and to complete my healing. Um, but to this day, guys, um, it affects me still today. I had a follow-up appointment with that pulmonologist who apologized profusely uh, for that hospital. He no longer works there. 3 months after I discharged from that hospital, another person from that same area went into that same hospital with the same diagnosis, and he died within 48 hours. So I'm almost positive that they started him on the sepsis protocol and they let him lay there and die. To this day, I can't sleep without a fan blowing in my face. Um, I can't have anything over my face. I used to curl up with blankets when I sleep, around I can't have anything blocking my nose or my mouth at all. Um, I woke up every night pretty much for a couple of months after that, panicking because I guess I was dreaming that I couldn't breathe. The pulmonologist told me that from this point on, I would be really susceptible to pneumonia and that I will also have to um, see a pulmonologist every, couple of years just to make sure that I'm not developing pulmonary fibrosis. And that would be from all the scarring. So, normal saline, it has saline crystals in it. And so, when your body is oversaturated with that, it starts going into areas it's not supposed to go into, in your lungs, for instance. Those saline crystals get into your lung tissue, and as you're breathing, those crystals are scratching that lung tissue, and so it causes scarring. And over time, that scarring can develop into pulmonary fibrosis, which is, in my opinion, because I've had patients with it, it is the most horrible death that somebody can die. Um, it's an expensive diagnosis to treat. Um, so when COVID hit, the mask it was a non-starter. No, I cannot put anything over my face. And I know I live in Florida, but when this thing first kicked off, and they were saying, you had to wear a mask here, and you couldn't go into a grocery store, I was like, screw it. I got to have groceries, and I'm going into this grocery store, and I don't care. Because if everybody else has got a mask on, great, you're protected. So, not to mention, I'm not going to say what I want to say, but as a nurse, you probably can figure out what I want to say. Um, the surgical mask was what everybody was wearing, so I'm like, I'm going to get my groceries. I'm not putting a mask on my face. And so nobody really said anything to me. I didn't even get dirty looks or anything. And we're talking about, I did this for months on end. And I went into a grocery store one time, and this older lady that had worked there, she was in that grocery store every time I went in. And she looked at me and she goes, "You're supposed to have a mask on." And I said, "What?" She said, "You're supposed to have a mask on." I said, "Honey, I can't understand you. You've got two masks on your face." She had on a surgical mask, and then she had on an N95 that had I guess it was the valve in the front that has, the hard plastic cover on the top of it. So she comes up to me and she says, "You're supposed to have a mask on." And I said, "I don't have to have on a mask. I'm exempt." She says, "There are no exemptions." And I said, "Honey, let me tell you something. If you had been through what I went through, you wouldn't be putting anything over your face either." I said, "So mind your business, and I'm going to finish paying for my groceries now." So she just kind of rolled her eyes and walked away. And so that's what I did. And no, I did not get the whats. Did not get those. Um, the company that I work for, the home health company that I work for now, is the same one that I worked for back then during COVID when it started. And, they didn't mandate it for us. They respected our religious beliefs. And so all we had to do was fill out this form and sign it and send it in. And then we even had staff who were just signing it and sending it in because they were of the opinion it's none of your business what my religious beliefs are. The only thing that you need to know is that no, I'm not taking it. And so they respected us. Our company respected us and they did not require it. And so um, it was still going on though, and there's this whole thing, with the mask. Now they were making us do the whole protocol, the PPE protocol when we went out to see patients. And even though I worked in the office, sometimes I did have to go out and see patients. If we had a nurse out or if the nurses were overloaded, I would go out and take some patients. Well, I wasn't going to be able to do that and I started to see it becoming a problem. And so we had a new division, I guess you'd call it, open up to where it was a work from home position for RNs, and it was to audit charts, audit the patient charts for CMS. And so I applied for that position and was hired into that position. And so I've been doing it um, since COVID. And I love every minute of it. I work from home all day, every day. And so, anyway, so if you have watched to the end, um, please, guys, and going back to COVID, and this video may get, banned from YouTube. I don't know. But going back to that, all of the stuff that happened in the hospitals back then, um, the hospitals just are not the same. They're not the way that they used to be. Even when I graduated nursing school back in 2009, they're just not the same. And had it not been for my husband being a paramedic and recognizing just by looking at me, he had no idea what my ABGs were. He didn't ask the nurse what my pulse ox reading was. Um, he took one look at me and knew that I was going into respiratory failure and that I needed help. He was my advocate. Had it not been for him, I wouldn't be here making these videos today. And, life is short, guys. It really is. You never know what can happen. So, guys, I just want to encourage you. And yeah, I still get a little teary eyed and choked up about it because I don't know if you have ever not been able to breathe. But for me, not only was it scary, it was excruciating, and I didn't know if help was coming. And I felt like I was going to die. So, my advice is if you ever have to go into the hospital, take somebody with you. Take somebody with you who can stay there with you and be your advocate. Somebody who will ask the questions. If you get to a place where you're not able to think, you know, what are they putting into my IV? Um, so I'm going to tell you a few things. Number one, your nurse is supposed to tell you what medications you're getting and why you're getting it. If she cannot tell you those things, do not take that medication. Um, they cannot give you a PRN medication. Let's take, for instance, an opioid. You have to ask for that medication. Those are that sometimes they will have them scheduled, especially if you were post-op. But for people like in my situation and my next door neighbor, that those first couple of nights, those are PRN medications, meaning as needed, and patients have to ask for those. So if they are coming into your room and they're putting something into your IV or they're handing you a little cup with pills in it, ask them what it is they're giving you. If you have any questions or any doubts whatsoever, don't take it. Request to speak to your doctor. Um, have somebody there with you that can ask questions. Like if they come in and you're asleep, um, that have somebody there with you so that they can wake up when somebody comes in if they're coming in to put something in your IV in the middle of the night. Hey, what are you giving mom? Hey, what are you giving my dad? What are you giving my loved one? Um, look up. Most people have laptops, cell phones. When they tell you what they're giving you, look it up, Google it, ask them how you spell it. Um, Tell them to print you out a list of what they're giving you and look it up. Know what it is that you're taking in the hospital. Do not trust them. Um, find out what their protocols are. Know who your doctor is. If you're in there for pneumonia, like I was, the only doctor that I remember seeing was the ER doctor. A pulmonologist took over my case once I was moved upstairs, but I never saw him until I was tanking. So find out who your physicians are, write their names down. Find out how you can get in touch with them. Find out who the risk management person is. Find out how you can talk to them. Usually you can pick up the phone next to your bed. There's an extension. Um, yeah, risk management. You want to know who the house supervisor is and you want their extension. Find out who the charge nurse is, and that's going to change from day to day, but find out their extension. Um, if push comes to shove and your loved one is tanking and you have done everything that you know to do, call 911 from that hospital room and tell them what is going on. EMS will have to respond and they will come to your room. At least that way you have got everybody's attention at that point. Don't just lay there and take for granted that your nurse knows what's going on. My nurse she was an older lady. Well, she wasn't old, don't get me wrong. She was probably about in her 40s or 50s. Um, Sweet as can be. She wasn't rude to me at all. Sweet as can be, but it didn't click in her brain, and it should have. I've got this lady's oxygen up to 4 liters. This little thing on her finger is telling me that her oxygen is at 100%. But I'm looking at her and she's not doing well. She's in respiratory failure. What should I do? The first thing you're going to want to do is call the doctor. If you can't get in touch with the doctor, that nurse should call respiratory. If for no other reason to come up and do an assessment, um, you can call respiratory stat. If respiratory gets to you, now this is if you have pneumonia, any other kind of respiratory, whatever going on. If respiratory gets to you and they need to call a code, if they feel like you are, um, an arm hair away from not breathing anymore, they can call a code. They can have a team there ready to go, but you've got to get the attention of these people. So that's why I say, if you've done everything that you know to do, you've called people, they're not listening to you, your loved one's not getting any better, call 911. Tell them what hospital you're in and your room number and tell them to get there now. And I promise you, not only are you going to have a couple of pairs of fresh eyes on you, but you're going to have everybody's attention at that point. And so I just wanted to come on and tell you my story, um, and to let you know what you can do to help prevent that. Take somebody with you to be your advocate. If you don't have anybody, be your own advocate. And as soon as you get there, ask for those extensions, those phone numbers, um, those names. And I'm going to say it again, risk management, um, a charge nurse, and find out who your doctors are. Who are they consulting to come and see you? Is it cardiac? Um, is it respiratory? Is it urology? Um, you know, question these people. Ask for your med list. Tell them to print you out a med list of what they're giving you. Ask them when they come into your room, what are you giving me? So, guys, that's it. Um, I just wanted to come on and tell you that because I am hearing more and more stories of people that this is happening to, and it's unreal. And I'm coming and saying that as a nurse, as a registered nurse. And so there you go, guys. I hope you enjoyed this video. Please subscribe to my channel, give this video a thumbs up, and help push this video out there. You know, this information needs to be out there. People need to hear this so that they can do what's necessary to advocate for themselves when they have to go into the hospital. All right, guys, take care, and I will see you on the next video.